been described as one of the most important free speech cases in US history. Now, I'm not talking about Trump's third indictment, a class action against the Biden administration for allegedly colluding with and coercing social media platforms to suppress disfavored speakers' viewpoints and content during the COVID pandemic. Make no mistake, this is a lawsuit of which the outcome could have implications for us all, wide-ranging and massive indeed. Joining me to debate this, two very interested parties. Dr. Jay Bhattacharya is a co-signatory to this lawsuit, a very outspoken voice against lockdowns during the COVID pandemic, and former White House coronavirus response coordinator, Dr. Deborah Birx, who publicly witnessed one of the most infamous, it could be called, moments during the pandemic. Let's just remind ourselves.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that.
Dr. Deborah, I will come to you first on that. I know you probably end up getting asked this a lot. We don't want to dwell on that past too much. But I remember watching that very clearly, listening to the president at the time, Donald Trump, talking about that, talking about injecting bleach, watching you on the sidelines there and wondering what was going through your mind.
Well, you know, he was talking to Dr. Bryant. You can see his head and you can see he's turned away from me. And we actually had scientists, Dr. Bryant, do a study so the kids would get back outside. It was April, it was spring. I was worried about kids being inside. Mayors would not they closed all the playgrounds, and I wanted children out on the playgrounds. So we asked the scientists to study sunlight compared to disinfectant for metal, plastic, and cardboard, to be able to reassure parents and mayors that children could go outside because the sun was a great disinfectant for COVID. Somehow, between when we discussed that at task force and 45 minutes later, when we came to the press briefing, I think Dr. Bryant had gone to the Oval and engaged the president in discussing this as a therapeutic. It was never studied as a therapeutic. It was studied, in fact, that would be dangerous. It was studied for playgrounds and to get children outside.
So you're saying there was a bit of a miscommunication going on. And I do want to say you've got a book coming out, Silent Invasion, The Untold Story of the Trump Administration, COVID-19 and Preventing the Next Pandemic Before It's Too Late, of which our viewers can maybe hear a bit more about that. But Dr. Jay Bhattacharya, I want to come to you on this court case we're hearing about at the moment, the Biden administration, well, a case against the Biden administration, this idea that the government allegedly is coercing or suppressing social media companies to silence voices like yours. I think it's fair to say, because you have said you've been sort of shadow banned on Twitter, for example, for things you've said about lockdowns. What made you a co-signatory on this lawsuit?
There's nothing alleged about it. The Biden administration has an enormous censorship complex, basically aimed at controlling and silencing voices on social media that criticize its policies. In fact, it uses the muscle it has over the regulatory, regulation of social media to induce Twitter, Facebook, you name it, to slag lockdown opponents, and in fact to suppress criticism of the misinformation that the Biden administration itself is putting out on things like immunity after COVID recovery, on the inefficacy of the vaccine to stop disease spread, on the efficacy of masks, vastly overstating the evidence on that, on the harms of the school closures. It was on item after item. What you see is the Biden administration suppressing the speech of critics, using its government power to censor in a way that is not consistent with the American First Amendment.
Well, it's alleged until it's proven in a court of law, of course, and that's what we'll have to wait and see. But thanks for setting out your stall on that. Dr. Birx, I want to come to you and get your response to that, because you have said previously with regard to kind of the post-match analysis, even though some would argue the pandemic's still going, that some of the backlash against the way it was handled to some extent is deserved or warranted. Do you think the same with this social media argument?
Well, I loved your last segment because it talked about empowering the consumer with all the information they needed in order to make decisions on what to buy. And even today, we don't put transparent information out there about infectious diseases. I mean, we're talking about an app on buying coffee, and we don't have an app where everybody across the world can see what's circulating in their area so they can make decisions about themselves and their families. because there are people that are still very vulnerable to COVID. My mother is 94 in a multi-generational household. Yes, she's been vaccinated, but vaccines in someone that elderly with that poor of an immune response, she may not mount an immune response. And so it's my job to provide the tools that we have to protect her. But every family is different. And that's why I've always found, I've worked in pandemics around the globe. If you empower the community with the information that they need, they will make common sense decisions that protect themselves and their families. I've seen this with COVID. I've seen it with Zika. I've seen it with Ebola. And I don't know why we can't give people transparent information that they can utilize on a day-to-day basis.
Well, certainly plenty of health officials, yourself included, both of you, tried to get the information that you saw was right and scientific out during the pandemic. Also, Dr. Fauci, also here in the United Kingdom, Chris Whitty, these top scientists. But it could be argued that the relationship between the public and the scientists, the public health authorities, broke down so dramatically over the course of the pandemic, whether that was due to government behaviour or what some would call unelected bureaucrats overstepping the line, depending on what side of the argument you sit on. But in terms of disseminating that information and the public actually taking it on board, Dr. Bhattacharya, can you not understand that there is an element of misinformation when it comes to things like Twitter, or should we probably call it now X? Does it not concern you?
I mean, I think the solution to misinformation of any sort is trust. And what happened during the pandemic is that the government it embraced censorship, it embraced positions that were contrary to the science, and then closed up the possibility of debate and criticism from the outside. And as a result, vast numbers of people no longer trust the government, the information that it provides. And so when there is actual misinformation afoot, they're not going to trust the US CDC or the US NIH anymore, because the NIH and the CDC itself embraced in misinformation. So if you want to combat misinformation, the answer is not censorship. The answer is to build trust in public institutions by behaving in trustworthy ways. And that is not what happened. By the way, a court actually did find the findings. It's not no longer alleged. The court actually did find that the censorship is going on by the Biden administration. These are facts that were entered in court and not disputed by the government. There are emails, depositions of Tony Fauci and others in the government who participated in the censorship industrial complex.
I just want to ask you what that trustworthy behaviour would look like, if you to boil it down, because if you have a volume of information coming at the public, they're trying to work out who they can trust or not, and this is what the COVID pandemic felt like for many. What does that trustworthy behaviour look like? How can people discern it?
Well, I think one is humility and openness to criticism, right? So if you have a high government official saying, if you criticize me, you're not simply criticizing a man, you are criticizing science itself. Well, that's just ridiculous. No one who can look at that and say, well, yeah, that person actually is able to keep an open mind and see if he's wrong and admit it. That kind of behavior exemplifies exactly how the government behaved throughout the pandemic. And as a result, a tremendous number of people, and they got things wrong. It wasn't simply that they were embracing science and they got it right and they're criticizing people on the outside who got it wrong. They got things wrong over and over and over again. They overemphasized the efficacy of masking and mask mandates. They ignored immunity after COVID recovery. They ignored the vast evidence that if you get the vaccine, you can be infected again. And embraced mandates in its place. And a lot of people lost their jobs over this. So, it's not like it's so clear that the government got it right. And then they also block debate. I mean, I think if you want to build trust, you have to build institutions that are willing to engage in debate and be open-minded instead of what we had during the pandemic.
And it's funny, Dr. Birx, you mentioned that we're speaking about culture wars at the start of the show and values-based buying, because a lot of this does strike to that argument about whether people are thinking in an ideological way or believing science, and whether both can happen at the same time. It's all about freedom of speech. It's all about being able to choose your side, isn't it? But when it comes to a pandemic and a public health emergency, do scientists know best? Is there a rationale for them overstepping and dictating how people should live?
Well, I think we've learned from prior pandemics that you have to put all the information out there in a digestible way. And when you cut corners pretending that if you were infected, you are protected from future infections, you're not protected from COVID if you've been naturally infected or multiply vaccinated. You can get infected. And I just feel like we've divided this into an absolute when this is not an absolute virus. We don't even know to this day whether long COVID, what it really is, how many people get it, and what are the long-term consequences of multiple COVID infections. It is not flu. It's a unique virus. It is still being discovered what it does. And I agree with Dr. J about really continuing to put the information out there in an honest and transparent way so that people can make decisions by both ignoring the fact that COVID is still with us, as well as pretending that our vaccines can reduce herd immunity and protect against infection, leads people absolutely confused. And you see this even now today in the United States, where they have politicized rural health and implying that people in rural areas are dying at a higher rate because of their vaccine status. It is because they don't have access to any tools, because primary care isn't there anymore. And they've been dying at a higher rate from cancer, diabetes, hypertension, all of these other diseases for 15 years. And we're acting like it was because of how they voted versus their access to healthcare. So I'm hoping that everybody steps back and looks at what the true issues are. And for the UK, please keep your data up. We've decided that COVID doesn't exist and we've taken our data down. So I use your data to understand what's happening and what we're going to see in the United States in order to protect my mother.
Well, you're going to get a lot more data. Apparently, there's a lot of people with COVID in the UK at the moment. Dr. J, before we wrap up this conversation, I just want to ask you, information is one thing, but legislation, of course, is another. At least 30 states with Republican legislation have passed laws since 2020 limiting public health authorities. That was reported in the Washington Post. So basically legislating into the next pandemic that health authorities can't say you must wear a mask or these schools can't be locked down. Depends on a state-by-state basis. Do you think that's wise?
Yes, I do. I think that the public health authorities abused their trust the public had in them during the pandemic, violated basic civil liberties, including freedom of speech, freedom of association, freedom to worship, and huge violations of basic rights. People need to live. They need to, go see their elderly parents. They need to, and authoritarian orders that violate that should not be given in the hands of public health who have shown themselves to be untrustworthy. If public health wants to control behavior, they should do it in honest ways by giving good, solid information, being open to correction from the outside. And then if they're giving honest advice, people will listen to it. It's trust that is the key, not mandates and authority of the sort that public health arrogated itself during the pandemic.